حاليا احنا على اللايف فيسبوك. Good evening. We welcome Dr. Ashafi in our meeting about the issue of COVID-19. This time we are concerned on new variants of COVID-19. We start conversation with the first question. Welcome, Dr. Ashafi.
Thank you very much for inviting me. It's a great opportunity to be with you again for a second time for an important issue. Thank you. Please start.
We start the first question. Can herd immunity be long-lasting?
Well, herd immunity, it has been fluctuating in the mind of the people. I mean, during February, March, the world divided between two camps, those who are with the herd immunity, those who are not. And then hence there is a different approach to whether to close the schools and, the space and face and the masks. All these differences now appeared in the way to control COVID. Now it seems that everybody united because of the vaccination. Now people are talking about herd immunity. However, with this COVID virus, the immunity usually, I mean, by experience, because it's an evolved situation, it doesn't take, it doesn't last long that 2 months. However, those who produce the vaccine, they say we can offer you a 6 months immunity, but time will tell, and we will wait to see that because the vaccine it just started.
Okay. Thank you. Second question: can vaccine be effective also for new emerging strain or strains in UK?
Well, the COVID-19, which is the SARS-2. We had SARS, in 2002 and 3, and then we have the Middle East, which is again from the same family, and now this is the third wave. The problem with these RNA virus, they are misreading themselves when they replicate. So they don't produce exactly the same copy. Hence, we can have mutation all the time. So far, during the last year, there were 1,200 mutations. Though they are minor and everybody didn't notice any change in the virulence, now they worry about this new variant because it has accumulated about not 17 as everybody talking about, but the latest reports has accumulated 20 mutations. So it's a bit a tricky situation. However, I mean, this has been noticed since September, and now we are in December. If the virus, if the new variant is virulent, then we will notice, its effect on the hospital. Now the question whether the vaccine has any effect, or the new variant will give us what you call immune escape, just like hepatitis B virus. Some of the virus escape the immunity of the vaccine, we will be in trouble. But so far, the indication that it is part of the natural adaptation, and we notice that although the virus is spreading, but it's spreading means actually the new variant is taking over from the current strains of COVID, but the effect is on as far as the virulence is concerned, is not actually noticeable, but people are a bit worried about the situation. So the virus now from 25%, the new variants change from 25% of the current strain to 70% within a short period of time, then we have to watch the situation.
Okay. Third question, is it more effective to take more than one vaccine from different company at the same time?
If we are concerned about the new variant, the answer probably not. And we don't know actually the consequences of it. regarding the safety. There are two major vaccines. The traditional one, which are the Sputnik, which is the Russian, then the Chinese, and the British one, and then the American, which is the Pfizer and Moderna. They're both, the American ones actually both a new version of vaccine, which they rely on messenger RNA, which is now recognized as a genomic addition. Which, what I mean by that, because the messenger RNA is the message of the DNA that goes to the ribosome and tell the ribosome to do what is required from the messenger. So the messenger RNA it depends on nanotechnology. So what is happening, that this messenger RNA has been created, manufactured, put in a nano particles, are double layered lipid, and injected, and these nanoparticles go inside the cell and tell the ribosome to produce the spike proteins.
Yes.
The other traditional vaccines, which are, all the other vaccines are traditional, simply, and the majority of them actually, they take the gene of the virus that make the spike proteins and insert it into a vehicle. And these are usually viruses. The chimpanzee's virus, which is the Cambridge one, the British one, and or an ordinary human adenoviruses. And these viruses are not harmful to the body. Having it sounds that it may be, I'm not sure, but it
Yes.
could be that the messenger RNA is more specific. Hence, it may, time will tell, it may be designed for the current the circulating coronavirus, but and may not be sufficient or efficient against the new variant. However, the technology is there, and they can make it, updated, basically. The other thing about vaccination and immunity, because when we get an immunity or antibodies, most of these antibodies are mixture of specific antibodies to the spike protein, and then we can collateral or cross-reacting antibody that may cover variant organism, and hence we could be okay at the present time.
Okay. Also, I want to ask you about what about the new strain and the children's susceptibility?
Well, we heard rumors, but unconfirmed news, that the new variant actually is more efficient and transmitted through the children. I need to clarify this. Transmissibility is a good measure of cross-infection. So far, the PHE guideline states that the current virus, you need face-to-face the presentation between the infected person and the recipient person within a meter, without face mask, for 1 minute, then you get cross-infection. This sort of transmissibility has not been measured with the new variant, number one. Number two, the new variant has changed its spike, make it more efficient in attaching to the cells of the body, hence it goes inside and multiply. However, this is maybe an adaptation, and as I said to you, because of the new variant has been noticed in September, and so far we are nearly 3 or 4 months, we didn't notice any increase in the virulence. And what I mean, the virulence means that there is no serious disease registered due to the new variant. On top of that, since September, we are more efficient in terms of typing, detecting the circulating virus. So again, this is an evolving situation. It may be that we are more efficient in detecting, hence we may find more. So again, we have to wait and see.
Okay. How we can assess the new strain virulence?
Oh, that's a very interesting question, actually. Virulence is a clinical picture.
Yes.
Um, in microbiology or other, in bacteriology specifically, sometimes they use phenotypic
Yes.
laboratory characteristics, which are associated with with the clinical infection. For instance, I mean, a Staph aureus that is positive with the enzyme, we call it PVL positive Staph aureus, may be associated with severe lung infection or skin diseases and may result in the patient goes to the ITU. This is very well recognized. However, in virology, especially with the new variant, we do not have the laboratory diagnostic parameters, but we rely on the clinical information. So if we have, say, more patients, not necessarily only infected, because we are not worried about infection, because infection may mean increase in the herd immunity, and this is the same function of the vaccines. But virulence means that more patients actually going to the hospital and more patients go to the intensive care.
Mhm.
Currently, because the infection is so spread, you can tell most of the patients go to the hospital, elderly patient, when you test them, you find corona positive. So we have to be careful about the statistics, whether they are representing an increased seriousness of disease, hence the virulence, or simply the virus is taking over and spreading.
Okay.
Thank you.
Can we say that the vaccine may be cause for new strain generation?
The vaccine, you mean that the vaccine can cause selective pressure?
Yes.
Is that what you mean?
That's I mean.
Well,
Yes.
selective pressure of the vaccine, we have an example. Meningitis serogroup B was increased and was noticeably increased because we have vaccine to A and C and other serogroups of meningococci. And this is very well known. Now, um, with the new variant, because it is an adaptation and maybe a selective pressure, there were a few we can say speculation rather than actually good documentation. It may be due to the increased use of antiviral during the severe part of the pandemic, which I mean March and April and May this year. So there is a selective pressure, just like antibiotic resistance.
Yes.
When you put a lot of antibiotic or misuse of antibiotics, then you get selection of the resistant one. That's one thing can be explained. The other explanation in the report saying that it may be that the plasma, which is full of antibodies and
Yes.
other things not specified yet, which help in ameliorate the symptoms when it was given to the immunocompromised, it may put selection or selective pressure and get a more mutation. The reason for that, because as you know, the virus stay longer in the immunocompromised, and the body will be just like a good culture medium for selection, and mutation of the viruses.
Okay. In case of a previously infected persons or vaccinated, can they get the infection with the new strains?
Well, it is very interesting that all the vaccine tested and proved to be producing anti-spike antibodies, and tested and proved to produce T cells. And as I said, they have not tested in the field. In fact, now we are, because there is an urgency to use the vaccine. So we are now actually testing them in the field, and we may take to the next winter to see the effect. Sorry, what was the question about the? Was it about the cover of the vaccine, or
if person infected, previously infected person, or vaccinated, can they get the infection strain?
Yes. The vaccinated people, as far as the company said,
or previously infected,
or the previously infected, we have documents that people may have a second infection after 2 months, which is very short period of protection. However, the company said this the vaccine give you at least 6 months. Now, because the vaccine more concentrating on the spike protein, because these are the attachment points of the virus to the cells, then it is wise and prudent to attack them. Hence, the vaccine, produced for that purpose. Now, there is a little problem. Again, we don't know about it. If the vaccine, the more the vaccine is specific, which you can say that the messenger RNA is more specific vaccine compared to the traditional vaccine, then we may need to upgrade the messenger RNA vaccine more than the traditional vaccine, because the traditional vaccine, there may be, inverted comma, a crude vaccine, but the crude vaccine can give you more antibodies, because it's not only the spike proteins. There is another structure in the virus which help in the in the process of introduction into the cells, and then there are antibodies to the outer membrane of the virus. So although the spike protein are the main one, but there are antibodies to the whole cover of the virus. Again, we wait and see.
Okay. طبعا نختم الندوة بسؤال باللغة العربية دكتور شافي. ما هي خطورة السلالات الجديدة حاليا، وهل ستكون أكثر ضراوة من الكوفيد 19؟ بدقيقتين.
يا حبذا لو اكو سلايد اذا موجود مال تطور الفيروس. تطور الفيروس
تشرح لنا اياه بدقيقتين حتى نختم الندوة دكتور خالد.
نعم. الفيروس كغيره من الكائنات الحية يجب أن يتطور، والفيروس هو جرثومة صغيرة لا تفكر مثل الإنسان الذي هو سيد المخلوقات ويقدر أن يأخذ أدوية ولقاحات. ما تعمله الفيروس هو الطفرة الوراثية، أو أنها تأخذ جينات من بعضها أو من أي كائنات أخرى حتى لو كانت بكتيريا. فهذا التغير في الفيروس هو عملية مستمرة للتأقلم، وحتى تتمكن من الاستمرار بالحياة. وتعرف أن يعني الفيروس بحاجة إلى خلية حتى يدخل بها. ولهذا السبب أنه النيو فاريانت هو more efficient، يعني أكثر قابلية على الدخول داخل الخلية. لكن لحد الآن يعني ربما تكون أخبار مفرحة أن الفيروس الجديد هو متأقلم ولكنه ليس خبيث.
شكرا جزيلا. Thank you so much دكتور الشافي. نلتقي إن شاء الله في لقاء قريب بإذن الله. شكرا جزيلا.
شكرا جزيلا. مع السلامة.